Good afternoon, everybody. It's Dr. Galvin with another update. We're going to talk a little bit about coronavirus. You know, as the cases drop, as more people get immunized, it's becoming less and less of a thing. So we're going to start transitioning to more health-related things. I'm Dr. Jeffrey Galvin. I'm a board-certified emergency medicine and also a functional medicine doctor outside of Charlotte, North Carolina. I've been reporting about corona and COVID since the beginning, but I also do a lot of precision medicine, anti-aging, weight loss, hormone replacement, things like that. So to start with, we just crossed a pretty good milestone, 300 million vaccinations given out in the U.S., which is a huge number. We know that since January 1st, cases in the U.S. have plummeted since having a very, very bad January, as I reported how bad it was with COVID in the emergency department. Now we really rarely see COVID patients in the emergency department who are really sick, and the ones that we see are almost invariably unimmunized. We haven't seen anybody who's been immunized be particularly sick with, I haven't seen a single one myself, but my partners haven't noticed anybody. Nobody's seen anybody who's been really, really sick with it, who's been immunized, which is good news. Along those lines, I want to talk a little bit about a different vaccine that we don't use in the US, the vaccine by Chinese company Sinovac that's being distributed in lots of places around the world. Not nearly as effective as the ones we're using here, which are in the order of 97, 98% effective. That vaccine is felt to be about 50% effective. However, they did an interesting project called Project S in Brazil. And Serrano, Brazil is a city that had a horrible COVID problem. I think at one point 1 in 20 residents had COVID, and it's a bedroom community, and so people from there go and work in all these other cities, and corona was spreading basically from this town. And so they did a pretty impressive study where they decided they were going to immunize 95% of the residents, and they did that between February and April, and they eventually got 95% of the adult patients, I think almost 28,000 immunizations going. And they released preliminary results that have not yet been peer reviewed, but they're impressive nonetheless. Pending peer review, showed an 80% reduction in cases after that immunization program was done, but more importantly, 86% reduction in hospitalizations. Now, their medical system had been basically brought to its knees by COVID, completely fixed that. 95% reduction in deaths, which is excellent. So again, not a vaccine used here, but it shows the power of vaccination, even a vaccine that's really not as effective as the ones we're using here in the US. Since we do a lot with obesity and we do a lot with brain injuries and Alzheimer's in our clinic, there were two articles that caught my eye. One is about this new obesity drug called Wigovi. Well, Wigovi is actually not a new drug. It's semaglutide that's been used for years for diabetes. It's what's called a GLP-1 agonist. And it has an interesting effect that at higher doses, it causes pretty significant appetite reduction. And they've done a number of studies, I think involving over 4,000 people. And basically what they were able to demonstrate is that on average, those people dropped about 17 to 18% body fat and maintain that for up to 68 weeks. And in fact, in one of the studies, about 30% of the patients actually lost more than 20% of their body weight, and again, maintain it. Now, they combine that with a low-calorie diet, which, as if you know me, I'm not a big fan of, and also an exercise regimen. But the fact that they were able to show these very significant declines and at the same time maintain that over a year is amazing. It's really a kind of a breakthrough in terms of obesity-related drug. However, we've actually known about semaglutide for a long time, Victoza, Ozempic. They're similar GLP-1 agonists that also have a similar effect in weight loss. Do I use those medicines in my practice? I don't. Why is that? Because Ozempic for a month is about $900. This new drug, Wigovi, is going to be about $1,300 because it's a higher dosage. And it's going to be hard to nobody's going to come out of pocket for that. Remember, these results they looked at over 68 weeks, so over a year. So you can see that the cost of those drugs is going to be very prohibitive. And insurance companies, I think, are going to be pretty hesitant to approve that. We've never really been able to get anybody an insurance company to approve Ozempic or Victoza for a weight loss reason, although it's been known that we've used those drugs for a long time. However, there is a drug we use in our clinic that's also a diabetes drug that costs $4 that works great, that we've been using for years and years and years, and that's probably a better choice at this point. The next thing is a new Alzheimer's drug. Now, if you know anything about Alzheimer's, you'll know that we haven't really had any drugs for Alzheimer's for years. It's been decades since the last one was approved. I'm a believer that we're never going to find a drug for Alzheimer's because Alzheimer's is a multifactorial process, and we utilize the Bredesen protocol here in my clinic using RECODE, and have had good results in reversing Alzheimer's and improving it by looking at multiple areas, including lifestyle, hormones, nutrition, fitness, sleep, stress, all the things that we do. But the holy grail, of course, is to give a medicine that's going to cure Alzheimer's. And so there's a new drug called aducanumab that has been shown to reduce amyloid plaque in the brain. Amyloid plaque is thought to damage neurons and be one of the underlying causes of Alzheimer's. However, there's been a number of drugs used and tried that reduce amyloid beta, but had no effect on Alzheimer's symptoms. The FDA has changed the rules a little bit, and they're basically allowing them to use a surrogate endpoint as a mark of efficacy. So instead of requiring them to show symptom improvement, what they're allowing them to do is show that it reduces amyloid. And the inference is that if you drop amyloid, it'll improve cognitive factors. Now, the company that came out with this actually did a fairly big study, and I want to make sure I've got my numbers right. They had 2 trials, I think 4,000 patients or so, that were initially halted because they didn't show any benefit. And then a few months later, they went back and they reanalyzed their data, and they showed a 22% decrease in cognitive decline in the group that got the higher dosage. So I look at this approval with a little bit of scants because they're approving it because it reduces amyloid. However, this amyloid plaque there's never really been any proof that reducing amyloid plaque improves Alzheimer's at all. So it's the first one being approved for a long time. Do I think that it's going to be a game changer? No, I'm very suspicious about the approval process, and I think the advisory board that looked at it said not to approve it, and they approved it anyway. So I don't know what's going on with that. I don't have high hopes for that drug. Maybe they've got better data they can show us at some point. But anyway, those are 2 interesting drugs: semaglutide or Wigovi, very effective for weight loss. However, going to be prohibitively expensive. I don't know how much of an effect that's going to have on the average everyday person. This other one, aducanumab, for Alzheimer's, I give that one a plus minus at best. I'm Dr. Galvin. If you find these things useful, please like us on Facebook and follow us on YouTube. We will be doing more videos as we go along, and I hope everybody stays safe. Wash your hands. Wear a mask if you're not immunized. If you're immunized, enjoy your life. Have a great day. See ya.